Hi Academy members, welcome back. Just an interesting case I think I should share with you before we go to Masters this year. It's the question about short-term, long-term memory, Alzheimer's, and what we can do to have a look at this issue, as complex as it might be. The first thing we need to consider and appreciate is that the right hemisphere is recording everything in this present moment. The left hemisphere is very different. It's recording the past and your ability to plan going into the future. So we have a gentleman and he's had a bad accident probably 5 years ago now, a traumatic ripping a lot of his right arm to a very undesirable looking piece of machinery now. However, the right arm is functional, but his short-term memory is not. So the question from his wife was, is he now going into the stage of Alzheimer's? So when we think about the right hemisphere and its ability to relate to what is happening in this present moment, that was no problem at all, and no confusion as he considered that moment or any other moment that was in the long-term memory. If, however, we asked to relate to what happened yesterday at lunch, what did he eat for lunch, what did he and where did he attend that particular meal, that was difficult. It was like no lights were flashing when we asked that question. So because it's of a long term, in the past this has happened in terms of his accident and his inability to plan and relate to what was happening in the past, we had a look at the left hemisphere. So when we looked at the auditory memory and the visual memory and coupled those together, we had a result in terms of muscle function, and a distraction occurred when we coupled the visual and the auditory cortex together. So that was integrated using the appropriate, in this case, a suture, and then we looked at the learned response mechanism, which is the cerebellum, coupled with that with the auditory mechanism, no problem. Coupling the cerebellum with the visual, this is all on the left side, this is the left visual, nothing to do with the right hemisphere at all in this particular case. We're going from the cerebellum to the left visual cortex, and we have another signal distraction. So in again integrating that with the appropriate suture, we then waited for a few minutes, maybe 5 minutes, just talking about those issues, and then we had some glimmer as he started to recall what happened at lunch the previous day, some of the things he had eaten and where he had attended. There were other issues that day which were not clear, but at least we had a glimmer, and his wife was very excited to see that change in a fairly short space of time. But it's something that I think you should be aware of, that in the right hemisphere we're talking about this very present moment, but the left is very different. We're talking about the past and planning to go forward. So we're looking forward with interest to see if that helps this man progress. Hope you enjoy that and at least have a look at this in your own practice with regard to short-term, long-term memory issues. Thank you.